Hello everyone, it's my pleasure to be here. My name is Mattana Prumipapat or May. Today I'm going to talk about pediatric aquatic therapy, services, knowledge, and current practice in Thailand. What do we know and where do we go? I am a university lecturer and a pediatric PT at Naresuan University, Phitsanulok, Thailand. My background was a Doctor of Developmental Neurology, UMCG, the Netherlands, and this is my research team. Water has been used in integrative medicine since ancient time.
The physics of aquatic therapy. Buoyancy effects. Hydrostatic pressure. Viscosity hydraulic resistance. Thermal energy transfer.
Pediatric aquatic therapy, which I briefly call PAT, has been reported to be one of the best interventions in integrative medicine. We aim to survey the number of PAT clinical settings across Thailand and to understand the knowledge and current practice of the PAT for children with special needs by PAT professionals. From July to October 2024, 137 aquatic clinical settings across Thailand were surveyed, accounting for 177 PAT professionals. Result: we received 114 responses out of 137, which were accounted for more than 80% response rates of all respondents. 74 current PAT settings are found, and there are 91 PAT professionals in total. This pie chart shows the educational background of those PAT team. The majority number are PTs and mostly work in special education center. The majority of PAT staff age range between 21 to 30 years old. Work experience was about 1 to 5 years of the PAT field. About the children they treat, there are all age range and age group of patients, mostly with the school age as you see. The top 3 types of children are CP or GMFCS level, autistic, and Down syndrome. The PAT workload is about 1 to 5 children per day per one staff. Current PAT clinical settings are in the central region, followed by the northern and the northeastern regions of Thailand. And this is the category of the questions. 4 types. The average score is 12 out of 18 points. The multiple choice questionnaires show that most PAT professionals know the principle of hydrodynamics and the framework in their current practice, although some staff lacked formal education in aquatic therapy, such as the PT assistant and special educationist. The open-end questions, 3 themes were identified, as you see here. To sum up, this survey demonstrated the general perspective of the pediatric aquatic therapy in Thailand. 74 clinical settings in Thailand implement PAT to improve health and well-being outcomes for children with special needs. Next, where do we go? We could level up PAT as a holistic health and wellness training for practitioners. Now we have the Thai version of assessment tools, and I have a training. We keep exploring new techniques, and we plan to implement the online course for parents and health professionals. And reflections and feedback is always welcome. I am very thankful to the Korea Society of Integration Medicine for organizing this Congress. I sincerely appreciate the kind invitation to join this talk, and many thanks to the President, Professor Lee, and my senior best friend and colleague, Professor Oh. Again, it's a pleasure to be here today. You can always reach me via the email, and any feedback or questions as well as future collaboration are welcome.